CGTN 记者。我们知道疫情以来呢，一些区域需要
With CGTN and CEMG, since the COVID-19 prevention and control, there are some of the short-time demand PCR testing. How do we satisfy with short-time demand of the PCR testing? How are we going to provide an in-time PCR testing for those of the gateway cities? Thank you. Thank you very much. Since the outbreak of the COVID-19, in the year 2020, the State Council has printed a guideline of increasing the capacities of the nuclear asset testing, allocating all kinds of resources and the PCR testings. For all the different regions, they were trying to lend these resources. For one part, they are buying these equipments, increasing the laboratories and equipments, training the laboratory experts in the past 1 year. In the past 1 year, we are supporting the third-party nuclear asset testing and regulating the day-to-day effort. So far, the portable testing result, including the makeshift vehicles, has greatly improved the COVID-19 mechanisms. This dynamic supporting system to the port city has been enhanced in the past 2 years. According to the statistics, by the 30th of March 2022, there is 1,420 institutions who is conducting the services of the nuclear asset testing services, among which 8,824 are hospitals, and there are 863 third-party testing laboratories. The national testing capacity can be around 46 million testing tubes every day. So we are very strong in our abilities in terms of the testing. In the year 2020, we have came up with the technologies of the mixed PCR testing, and in the year 2021, we have a non-mixed isolated PCR testing. In this year, we have improved the testing result to around 20 people 1 tube. So that is to say, we can increase the capacity 20 times based on the current situation. So in terms of the PCR testing, we are leading across the world. For the sporadic cases of the PCR demand, recently, we have built a regional supporting system for one part in our province. We are allocating the resources in our province, supporting the PCR testing. For the other areas, if the local province and cities cannot satisfy with the current demand, we also have a regional supporting mechanism. You have mentioned that in the port cities, under the regular day-to-day work, their testing capacity can satisfy the demand. And once there is any cluster up of the COVID-19 cases, through the supporting mechanism, we are going to satisfy their demand. Currently, we are using several different measures to improve the short-term testing demand. For one part, we have built this supporting mechanism, especially this dynamic supporting mechanism. For the other part, for some of the lower risk regions, while we are conducting a large-scale screening, we are promoting the 20 people per tube testing methods. And for this 20 people per tube testing technologies, as well as the plans and also the large-scale PCR testing, we have conducted updated versions and also the trainings. And one thing quite important that we are using the informationized methods to improve the testing methods, and we are using the information technologies to test and to improve the testing result and shortening the time between the nucleic acid testing and the final result. And one thing quite important is that last week, the joint workforce on the prevention mechanism and the control mechanism, the State Council has came up with the antigen testing as a very important supplement to the PCR testing. By fully playing the role of the antigen testing, we are going to combine the two advantages of the PCR testing and antigen testings. And for the first time, we can test it on the asymptomatic cases of the Omicron strain and figure out the potential infected person. And that is to say, in the shortest period of time, we are going to control the infected the routes, and we are also going to spread the PCR testing, increasing the chance of the early detection.